Basically, that would include community health centers for the New Waterford Glace Bay area. Now, I guess the question I want to put around that is I realize that Doctors Nova Scotia and your department are discussing the deliverables, and maybe you need an AFP around that. But I just want to know, like, I think community health centers got to get a bad rap because they see what happened, how it was poorly portrayed in New Brunswick, and people see that as a loss of service, not a gain of service in some respects. But the whole idea of primary health care and as it relates to community health centers. So, and the initiative is, I know, is talked seriously about in New Waterford and Glace Bay. So I want to ask you, Minister, where's your department at in relation to this? And I suspect talking to Doctors Nova Scotia about their position, because I would suspect that they want to see some kind of AFP in place or something that where they would not lose money. So could you enlighten us on that, perhaps, Minister?
The Honourable Minister of Health.
Thank you very much, Madam Chair. And first of all, I want to say to the Honourable Member that our experience in Nova Scotia to date, and I don't see anything that's causing that experience to change, is in communities where they have had community health centers, as suggested by the Honourable Member. That is collaborative practices between a physician and nurse practitioners and others who may be part of that collaborative practice. The reaction has been extremely positive to those. And a matter of fact, in some areas of the province, the reaction that the DHA gets is, when can we get our nurse practitioner, or when can we get, because they really find that it's very positive. And one of the positive aspects of the alternate funding program, for instance, is that the physicians themselves, when they are with a patient, find that they have much more time to spend with that patient. But also, one of the reactions of patients is when they're with the nurse practitioner, then the same experience is true, that they find themselves in a situation that there's much more time to provide. With respect to the specific questions you've asked, if you don't mind, I will take those as notice and get back to you so that I can provide you with more complete answer than I could provide here this afternoon. But certainly in this province, we've had a very positive reaction to community health delivery vehicles, and our challenge is going to be able to respond as rapidly as communities want these facilities.
The Honourable Member from Cape Breton Centre.
Thank you, Minister. Thank you, Madam Chair. I guess I tend to agree with your position on it, Minister, and my only fear is that if you look at where some of these models were initiated, they were initiated in places that I believe, and I may, correct me if I'm wrong, in areas that didn't have existing facilities like a hospital. And so sometimes how these are introduced to the community may seem, and I may try to be a bit clairvoyant here, but say like in areas, oh, I know what this is going to replace our emergency department. This is what this is doing. And this is why I would hope that we would be out in front of it, because I see it, as you see it, as a very positive component to primary health care. And that I would hope that any initiatives that are done in both the Glace Bay and Waterford areas around primary health care and community health centers, that they're giving the proper public perspective, that people can be rest assured that it's not about shutting down somebody's emergency room. It's about really, in real terms, freeing up the healthcare providers to do what they're supposed to do and allow that to grow. So, Mr. Again, I don't want to come back, and I take what you said to me, the information you take under advisement and get back to me, and I appreciate that. But I guess the question is about the sensitivity of bringing, excuse me, that into areas where emergency rooms now exist. They exist in a fairly close proximity. I'm thinking like in areas where it's provided now, like in the Digby area, when you're looking out on the islands and that there, and the transportation hurdles that have to be attached there. But I guess I want to feel some level of comfort that when this is spread out, that it's spread out in such a positive way that people are seeing that this is what it is. It's an augmentation of the healthcare services provided by your department and by the DHA.
The Honourable Minister of Health.
Thank you very much, Madam Chair, and I appreciate the concern identified by the honourable member. Our experience to date, and it's not all in areas like Digby or remote areas of Cumberland County that we've had this experience. We've had it in other areas where there is better medical facilities or more readily available facilities than elsewhere. And our experience is that all of these facilities tend to sell themselves. And once we get them up and running, and people, they become the focus, and people are quite content to go ahead and get their services from these facilities rather than the so-called traditional model that's out there. So it's I appreciate the concern that you have, and you're quite right to say that we need to have people embrace these facilities on their own value, and not to judge them in relation to some previous service. And whenever that happens, our experience has been that the new model is the one that's most preferred by people.
The Honourable Member from Cape Breton Centre.
I realize time is getting short, and this question is not to give short shift to this very serious dilemma, but I'll try to make it very succinct, Minister, so I'll give you time to answer. The question around people with disabilities and community living, if you will, where we find people that are really in no person's land. They end up, they've got disabilities, they need some help living in their home, or need some kind of care, and the only option open to them is long-term care homes. But what we're saying is, I've got a young woman, I think I've written to you about it, Minister, that lives in the community, that she needs assistance in the morning, getting out of bed, she needs assistance for a few meals, and she needs assistance going back to bed. Now, some kind of community living space would be the best for her, but all the Department of Health says that they can mandate to offer her, and this is the same we hear from community services, is long-term care. Mr. Minister, I guess it was, what are you seeing in the future that would be there for these people? Because there's a real need today.
The Honourable Minister of Health.
Thank you very much, Madam Chair, and I want to say to the honourable member and members of the committee that you correctly identify a situation which, from our perspective, we want to see a better alternative for individuals in that circumstance. And I guess our emphasis is going to be on trying to ensure that individuals are able to remain in their home as long as possible, and that's what our province-wide consultation is all about, is to get people focused in that direction. Now, it may be that the circumstances that you're referring to are circumstances where the home care may not be enough, and the individual might need something beyond that, but not a long-term care facility. And that is part of the spectrum that we hope to identify through the consultation. And so what we're doing is trying to make sure that we explore all possibilities within the spectrum itself, and the situations described by yourself will be ones that I would hope would get a very good airing in this consultation process, and that we would get recommendations that may provide a better alternative than those described by yourself.
The time allotted for the official opposition has ended, and we'll move on to the honourable member from Preston at 4:09.
Thank you, Madam Speaker. I have just a few questions for the Minister, and hopefully they'll be easy questions. You put in the budget approximately $300,000 for chronic pain and wait times. Could you explain to me exactly what that money's for?
The Honourable Minister of Health.
Thank you very much, Madam Chair, and I want to thank the honourable member for the question, because this is an item in the budget that is very important to me, because I believe that one of the things we need to do is to try and do as much as we possibly can to assist those who are suffering chronic pain. And currently the situation is not acceptable. We have a wait time that approaches 2 years with respect to being able to get to a pain clinic. We are not organized in a way where if we were to provide the full infusion of funds, which we estimate to be in the vicinity of $1 million, to be able to suddenly shrink that wait time. There needs to be an element of planning and preparation in order to address that, as well as some resources being applied throughout the course of the year to start reducing the wait time. So while the number that's identified within this budget is $300,000, and a portion of that will go to planning and preparation with respect to addressing the longer wait time, it is part and parcel of a larger commitment to ensure that we get appropriate wait times in place with respect to the pain clinic. And certainly we're a long way from that now, but we do believe that with about $1 million we can adequately address that and bring that wait time period to a much smaller number than is currently the case. So you have to think in terms of the $300,000 as being part of a phased commitment with respect to addressing the pain clinic wait time.
The honourable member from Preston.
I appreciate your answer, and I'm going to ask a couple of just sort of small questions. Maybe you can answer them all at the same time if you can. The $1 million you talk about, would that be annually, or would that be on a annually? Would this be connected at all to the problem that we're having in the province now with chronic pain and the Workers' Compensation Board? Are those two things tied together in any way?
The honourable Minister of Health.
Thank you, Madam Chair. As I understand the situation with workers' compensation, it has to do with the processing of the claims, as opposed to the situation I'm talking about, which relates to anyone who is awaiting treatment for chronic pain, to try and provide some relief to that pain that they are suffering, whether they're workers' compensation cases or other citizens who experience chronic pain.
A member from Preston.
I thank the Minister for his answer. Maybe I didn't make myself clear enough, and I do appreciate the answer you gave me. Maybe what I should ask is, with the problem we've had with chronic pain and workers' comp, people having to wait a couple of years to get diagnosis or treatment or whatever the case may be, may prolong that situation for new cases, in this case probably, rather than the older cases that haven't already gone to the chronic pain clinic. Would that have a bearing on the outcome of that? Do you think that some of the people might be able to be helped? I'm not asking a medical question here, just the philosophy of it and what the overall philosophy of the process would be.
The honourable Minister of Health.
That is related to the issue of the planning that we need to do to get a good handle on precisely what it is that we're dealing with and in terms of these questions. And that's why we want some of this money to be spent in that way, as opposed to being flowing directly into the clinic in the first instance. We want to do that planning and get it underway so that we can move forward, understanding all of the complexities that are out there with respect to the issue of pain and pain management.
Honourable Member from Preston.
I appreciate that answer. I know it's a very, very difficult situation with chronic pain. I deal with a lot of people that have chronic pain with workers' comp, not workers' comp, but Canada Pension disability claims, and it's a very, very complicated question. So I do appreciate your answer. I have another question, and some of these answers you may not be able to give me today, and if that's fine, you can forward them later. Again, there was some discussion just earlier here about head injuries, and I don't know if you give the answers at that time, and if you did, that's fine. You can just indicate that you did, and I'll look them up. I'd like to know the cost of treating, typical cost, average cost of treating a head injury. When I don't mean just someone whacked me on the head, but a serious head injury, if you have that information, and what the potential outcomes are of head injuries. Are they, someone gets a serious head injury, is it usually not reversible or not usually the case, whatever the percentages are, and I'm just looking for percentages here. And also like to know the stats on the causes of head injuries by age group, like in children, young adults, older adults, and seniors. That's a lot of questions at once there, but.
The Honourable Minister of Health.
Thank you very much, Madam Chair. The honourable member correctly anticipated my response. I'll be glad to take those questions as notice and get back to you with the detail that they require.
The Honourable Member from Preston.
I just might ask one other thing about this as well. What preventative steps, when you maybe bring the information back, if you don't know the answer right off your hand, off right away, what preventative steps are undertaken? I don't know if it's a fair question to ask you or not. If it's not a fair question, just tell me, and that's fine in the process.
Honourable Minister of Health.
The highways and transportation and public works are both initiatives.
There is, thank you, Madam Chair. There is a injuries prevention strategy that is led by the Office of Health Promotion, and a very important element of that strategy relates to the prevention of brain injuries. And I also know that the Department of Transportation and Public Works are also very much involved in safety initiatives with respect to preventing injuries, and very important injury prevention field is the area of preventing brain injuries. And so there are initiatives underway, and the honourable member might want to question the Minister of Health Promotion further with respect to the initiatives that his department is leading.
Honourable Member from Preston.
Thank you very much. That's all the questions. I'm going to turn it over to my honourable colleague.
The Honourable Member from Richmond.
Well, thank you, Madam Chair, and it's a pleasure to have the opportunity to ask a few questions of the Minister of Health and the Department of Health on behalf of the residents of Richmond County. Madam Chair, as I'm sure you'll be aware, healthcare continues to be one of the top priorities for residents in Richmond County. We have a aging population, but at the same time, I'm also pleased to report that we have a number of young families that have relocated back to Richmond County, which is something we're extremely proud of. So we do have a variety of healthcare needs, as with many other communities, and with those needs comes a variety of challenges, challenges that I'm sure that the Minister and his department are well aware of, and it's with some of those challenges that I wish to have some discussion with the Minister today. Minister, if I could start with the issue of the Richmond Villa. As the Minister is well aware, the current Richmond, and I'm sure the Minister is well aware of this one. I don't think he needs a briefing note on this subject. and I know it's one that's of particular interest to him, and we're certainly appreciative of that. As the Minister knows, a number of years ago, environmental studies were done which indicated that the current 75-bed facility located in St. Peter's had numerous problems, such to the point that it was not feasible for that facility to continue to operate. Based on that, the Department of Health indicated that they would fund the construction of a new Richmond Villa. And at the time, the original construction time frame that was provided to the residents of Richmond County and to myself indicated that construction would begin in November of 2002. Well, we all know now, Madam Chair, that we're in May 2005, and I regret to report that construction has not started. And needless to say, the residents who I've had the opportunity to visit with and are very sincere in asking, when are we going to get our new facility, and why we've been waiting so long. The staff certainly have expressed concerns about the state of the current facility, and family members of residents are also very concerned about the length it has taken, and their patience certainly has been stretched on this issue. Last fall, Madam Chair, the community of St. Peter's and the entire county of Richmond celebrated with the official announcement of a site for the Richmond Villa. So, Madam Chair, we have a commitment, we have a site, we have a sign, signs up, we have the plans for the new facility. So my first question today is, can the Minister of Health confirm if the tender for the construction of the new Richmond Villa has been awarded, and can he indicate who was the successful bidder?
The Honourable Minister of Health.
Thank you very much, Madam Chair. And what I can report to the honourable member is that the tender documents did go out, and when they closed, there was only one bidder that responded to the tender offering, and that bid came in considerably beyond the anticipated budget for the project. I can tell you that discussions are taking place between the single bidder and the department with respect to the bid. Any more than that, it's difficult for me to speak to, because it is a negotiation situation, and you know, once there is either a successful resolution of that or some other outcome, which I do not want to anticipate, then I think the less I say about it, the better it is, because of the nature of the discussions that are taking place. I will certainly undertake to provide the honourable member with as complete a briefing as I can after the process has been completed with respect to the information.
The Honourable Member from Richmond.
Thank you, Madam Chair, and I want to thank the Minister, and certainly I don't want to raise any concerns that are going to delay this in any way, but I know that a number of people in the community and others who've been watching this, I believe the facility is going to be in the range of $11 to $14 million, if I'm not mistaken. It's somewhere in that range. What many of them have asked is that why, considering that's quite an expensive facility, why was there only one bidder? And I'm just curious if the Minister, is this common practice? Because many people have been puzzled as to why, considering the nature of this project, it's quite significant, why there would only be one bidder. And I'm just curious if the Minister's Department has concerns over this, or if it just happened there was just one interested in this particular project, and if you can provide any information that would put concerns at ease on that specific matter.
The Honourable Minister of Health.
Thank you very much, Madam Chair. It's difficult to answer with any degree of certainty as to why there was only one bidder in this particular circumstance. But it is unusual, because normally you do get more than one bidder. There has been some discussion, and this is not scientific in any way, but there's been some discussion that we're we're a little bit a victim of some of our own successes in terms of the amount of construction that we have going on in the province relative to schools and renovations, hospitals and hospital renovations, and all of these things, that we have a limited pool of contractors, and their capacity to be able to respond is perhaps not as great as it would be in a period where there might be less of this activity taking place. That's not a scientific answer. It's some speculation to that effect.
Honourable member from Richmond.
Thank you, Madam Chair. Interesting spin on things, I guess, on it, and I'll let the people of Richmond decide if they believe that things are so busy right now in the Strait area that only one company was interested in bidding, but we've got one. Yes, we've got one. My understanding is that approximately over 30 tender packages had gone out on that specific project, and there is one bidder, but so be it. We have one bidder. My understanding in the most recent phone call I made about 20 minutes ago is that there appears to be a verbal agreement that has been reached between the department and the bidder, which is wonderful news. I'm wondering, with the minister not being able to give specific dates, can the minister indicate to us if that is the case, there is a verbal agreement and the documents hopefully will be signed in the future? Can we expect a sod turning ceremony soon, along with the beginning of construction of this facility? And can you give us any sort of a sample of what kind of time you expect that the residents should be targeting as for when they can expect work to start on this facility?
The Honourable Minister of Health.
Thank you very much, Madam Chair. I do know that discussions were underway between the department and the contractor. I have not had conversation with folks in the continuing care department today. So if indeed the situation is as suggested by the honourable member, it's not been brought to my attention. And the deputy and my chief financial person is here with me. So we, this afternoon at least, we've not had an opportunity to be brought up to date with that. I think I said last year during estimates that there's nothing that would please me more than to be able to go to Richmond and do a sod turning ceremony. And I can tell you, Madam Chair, if indeed an agreement presents itself in the relatively near future, we will have a ceremony not too many days after the House rises.
The Honourable Member from Richmond.
Well, thank you, Madam Chair, and I certainly look forward to that sod turning ceremony, and I'm sure we'll be able to find the appropriate shovels and whatever else might be necessary for the minister. And in fact, I spoke to a gentleman today who even asked me to pass on to the minister that the sooner the better, especially because lobster season is starting next week in Richmond County, and we're certainly hoping that he'll be able to join us in the very near future for such an important announcement in light of that. And that might be possible. One of the issues, Minister, dealing with the Richmond Villa, as you know, it's going to have the same amount of beds as the current facility, 75 beds. The difference is that a number of those beds are being set aside for some of the new programs that are being offered in long-term care, respite care beds, and I think there's assisted living type beds, which is wonderful news, and we certainly look forward to those additional services. The concern that has been raised, though, is that you are reducing the amount of long-term care beds that will be available for people who would be residing at the new villa on a long-term basis. Based on the fact that you just recently put out a call for expressions of interest for new long-term care beds under the Cape Breton Health Authority, based on the fact that the population is aging in the Richmond area and surrounding areas, I'm wondering what information or on what basis or criteria did your department conclude that a reduction in the amount of what's traditionally known as long-term care beds was warranted for this new facility, or whatever information you can provide that would put residents' minds at ease that there actually is a logic and a vision here that's being applied as a result of this reduction.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. Sorry. The beds that were identified for the district, Cape Breton district, 25 beds were part of a major consultation that took place in that area. And indeed, if you read all of the references in the budget documents, there is an additional 100 beds for the Cape Breton area that were identified. Now, these are beds that are required to do two things. One is to provide relief in the acute care sector at the Cape Breton District Health Authority. The other, of course, is to meet the needs of the long-term care population in that area. Now, with specifically to Richmond Villa, what is anticipated there, and I understand this is based on analysis of the population in Richmond, widening the spectrum of the types of beds that will be available there will meet the needs of the population as anticipated in the future. But we're also going to be placing a greater emphasis on keeping individuals in their homes for a longer period of time. It's part and parcel of the province-wide consultation that is taking place. And that's part of the reason that we have, for instance, made permanent the self-directed home care program. It's part of the reason we put more dollars into the home care. But we in no way anticipate that those funds are going to look after everything. We fully anticipate that the consultation that is taking place will assist us in determining how to widen the spectrum of home care options so that people will stay in their homes for a longer period of time. So it is part and parcel of that wider consultation as well as the long-term care beds that would be required as well.
The Honourable Member from Richmond.
Well, Mr. Chair, I appreciate the Minister's response, and I'm wondering, as I indicated earlier, if he could present me or the House with any sort of a study or some sort of review that would have been done by the Department of Health in drawing the final conclusion of how many beds would be required. And I guess my concern is that I'm aware of specific situations where individuals have had to be kept at the Straight Richmond Hospital, for example, for extended periods of time because of the fact that there was no bed available for them. So I guess the big concern is, you know, don't get me wrong, we're extremely happy to have a new Richmond Villa. I guess the issue is that are we losing an opportunity to build it with the right amount of beds now, or are we going to be down the road faced with a situation where, again, people are being kept at the Straight Richmond Hospital or St. Martha's Hospital or the Cape Breton Regional for extended periods of time because there's no long-term care bed available for them in Richmond County, either at St. Anne's Nursing Centre or at the Richmond Villa. So I appreciate the answer the Minister has given, and I hope he's right that this does strike the right balance, but I'm just curious, does he have any sort of study or report internally that was done that he could provide to me or to this House that would give some sense of comfort that this is the right amount of beds that are being constructed?
The Honourable Minister of Health.
Thank you, Mr. Chairman. First of all, I will undertake to provide to the honourable member the information that we have available, but I want to outline how that information was gathered for the benefit of members of the committee. A complete analysis was done of the home care, daycare for both seniors and children in the area. We took into account the respite, and that consultation took place with the folks at Richmond Villa itself, with the District Health Authority, with the municipality, and they were focused on the needs for a new Richmond villa. And so it was based on that consultative process that the design that is going to be brought to fruition in St. Peter's is one that reflects that consultation that took place. And as I said, I'd be glad to share the information we have.
Thank you. The honourable member from Richmond.
Well, thank you, Mr. Chair, and I look forward to receiving that information. Now, we've got the Richmond Villa out of the way. I know that the minister said that he mentioned it last year, and he said again this year. That was probably the one top thing he was looking forward to, was the construction of the Richmond Villa, and maybe the number 2 item might be getting a long-term, permanent doctor at the Straight Richmond Hospital. Mr. Chair, I don't know how to put in words the personal frustration that I have had in my 7 years as a member, the frustration of the staff and the volunteers of that institution, and the frustration of the surrounding communities, Richmond, Inverness, Port Hawkesbury, Mulgrave, that are serviced by that institution. Once again, the emergency room at the Straight Richmond Hospital is closed during the weekdays, 8 a.m. till 6 p.m., Monday to Friday, and this has been so since January of this year. This has been so even though the doctor that was there gave a month's notice that he would be leaving. And yet, so you can almost say the Department of Health has had at least 4 months, now going on 5 months, to try to address the situation. And unfortunately, we find ourselves again without a doctor during the daytime. And there has been some valiant efforts by some of the surrounding physicians to try to come in 1 day a week, 2 days a week, and we were left with a situation where the local radio station would announce the Straight Richmond is open on Thursday, it's closed on Friday, back open Monday, but closed Tuesday, Wednesday. It was just mass confusion. And Mr. Speaker, I've mentioned this, Mr. Chair, I've mentioned this before. Our greatest fear is that we are going to have a significant emergency where someone is going to land at the door of that institution between Monday to Friday, 8 a.m. to 6 p.m., and something drastic is going to occur because there is no physician there available. And I have to tell you, Mr. Chair, that we almost had a real-life example of that when we had the unfortunate bus crash that took place in Monastery, where students were returning to Newfoundland. Most of them were brought to the St. Martha's Hospital. 4 were brought to the Straight Richmond. Fortunately, it was a Sunday evening. There was a doctor there at the emergency room. How much longer can we continue before we roll the dice too long on the health of the residents in our community? So I asked the minister, can he explain his government's inaction in getting this vital emergency room reopened since it's been closed January of this year?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And and I'm not trying to be picky over a very serious situation. The word inaction is not appropriate with respect to the efforts that have been expended on the part of the DHA, the part of the Department of Health. The degree of success of that action is what is legitimate to speak about, and that has been a huge challenge, continues to be a huge challenge. I will say that that of course all of the EHS services are fully aware of the times when service is available at Straight Richmond and when it's not, and they will respond accordingly with respect to their destination on the emergency calls. I hear the announcements the honourable member hears. More than that, I read the announcements, whenever they're being made in terms of when the facility is going to be operational or not operational, and that is a huge challenge for us in the department, for the DHA, for the community, and I know that my office has been in conversation with representatives of the community on almost a weekly basis with respect to leads that are identified and trying to track down the leads, the challenges that we have of dealing with the College of Surgeons and Physicians when somebody who might be available is looking for an immediate okay from the College of Physicians and Surgeons, and they in turn feel it's appropriate for them to conduct due diligence with respect to prospective candidates that might come forward. And I'm sure that to the community, as they view these what would appear to the community as failed attempts, that it must indeed cause them to wonder what is taking place. We can't just accept anybody. We need to be certain that the appropriate licensing authority, which is the College of Physicians and Surgeons, are indeed satisfied that when they give their okay, that it is an appropriate decision on their part. We do our very best to bring to their attention the need to act as expeditiously as possible with respect to these situations. I know that this is not an immediate response to the honourable member, but it is something that I know the College of Physicians and Surgeons and Doctors Nova Scotia are working on with respect to finding methods to expedite the involvement of IMG personnel, international medical graduates, and that are currently in the province, and getting them appropriately licensed. The process currently in place is cumbersome. I do know that they're working diligently at trying to expedite that particular process, and if they are successful, there will certainly be some improvement there. From what they tell me, I'm encouraged, but I don't want to speak on their behalf at this juncture. It is a challenge. We continue to work very hard at it. It's not the only challenge that we have. We certainly have a very significant challenge currently before us with respect to Eastern Memorial Hospital in Guysborough County, Canso. We have similar challenges in other parts of the province, and we need to continue working at these things. I can just tell the honourable member that he knows the success we've had, but I can tell you that it's not for a lack of effort.
The honourable member from Richmond.
Well, it's, I guess the question becomes, how long can you sit in the mud spinning your tires until you eventually say, okay, something else needs to be done, or we're never going to get out of here? 6 years, and I don't even dare try to guess how many times I've either through question period, through resolutions, or through estimates, have raised the issue of chronic closures at the Straight Richmond. The minister knows that concerns have been raised about the level of remuneration provided to this facility. Because of its unique location and because of the challenges associated with it, is that many doctors are frustrated by the fact that where they're practicing at the Straight Richmond, doctors surrounding them are earning significantly higher incomes than they are. That issue is there, and the question becomes, the community is asking, well, at what point will the Department of Health look at addressing the remuneration to see if that could possibly provide long-term solution and get a doctor that is willing to stay for the long term? And we haven't heard anything about whether remuneration is being looked at, and maybe the minister can express that, indicate whether they are looking at that, and whether there is a possibility that because of its uniqueness, if not geographically, its uniqueness in that I can't think of any other institution in this province that has had the chronic closures of the emergency room department that this one has. And that's not a distinction that I'm proud to say that we have in Richmond, but I believe I'd say the minister would be hard pressed to point out to any other hospital in this province in the last 6 years that has seen the problems in the emergency room that the Straight Richmond has. So I'd like him to address that. The other issue is the frustrating thing here, and it may be time that we have a better look at the College of Surgeons, and maybe it's not this government that should be accepting responsibility for some of these actions, and maybe it's time that we had a serious look at their own actions. We had a doctor express an interest in coming to that hospital in January. He was in the US. There was an issue about his credentials. He received a phone call yesterday, indicating that his credentials were not sufficient to operate that facility. It took from January to May to get a decision. That's just not acceptable. In this day and age, 3-4 months to get a decision while an emergency room stays closed. Now, and I appreciate the minister saying they're looking to get some efficiencies. Well, they got a long ways to go. And if it is strictly within that College of Physicians, then let's call a spade, and let's try to deal with that problem and call them to task for what's taking place here, because communities are being held without emergency room service while it's taking 3 to 4 months to determine whether a specific doctor has gotten an interest. And the frustrating part is if we get a doctor who calls tomorrow and say, I'm interested, and there's an issue about his credentials, are we looking at another 3 to 4 months before we even find out if this doctor is someone that might be able to serve in this emergency room? So the question, 2 questions. Are you willing to look at remuneration? Have we finally gone far enough that it's time to look at the remuneration for the doctor at the facility? And number 2, how can we possibly justify the delay that took place by the College of Physicians in making a determination as to whether this particular doctor was qualified to work at this facility?
The Honourable Minister of Health.
Thank you, Mr. Chairman, and thank the honourable member for articulating his concerns as he has. And I will say that there are concerns that I share. The issue of remuneration, I'm informed by my deputy, has in fact been tried in the past to do that. I don't have all of the details with respect to that. At that facility, yes. During the day shift, to try and encourage some attendance at the facility for the provision of emergency services. The responsiveness of the College of Physicians and Surgeons is something that frustrates the honourable member, and I share that frustration in terms of being able to get answers. I'm not going to say to the College of Physicians and Surgeons that they should short circuit their process in any way that might cause them to be less diligent than they should be. We have and will continue to try to impress upon them the situation that people are facing in parts of the province with respect to getting timely answers. What I will undertake is to share with the College of Physicians and Surgeons the transcript of your comments here today so that they can have a better appreciation of the frustration that you and the people of Richmond experience as they await decisions with respect to prospective candidates. And indeed, when you wait that long for a decision, you live in hope, and in the hope that perhaps you have a solution to your problem, and it causes you to be perhaps ease off a little bit in terms of going after somebody else, and you develop a relationship with the person that you're recruiting, and you feel a sense of loyalty to that individual in the hope that they're going to become the answer to your problems, and so you don't put yourself in a situation where that person is is in conflict or in competition with some other individual. That creates all kinds of problems for communities. We're all human, and when you are dealing with a hopeful solution to a problem, you don't want to do anything yourselves to cause that person to become disinterested, and as a result, you behave accordingly. So the longer that a person has to live waiting an answer as to the qualifications, then it's really, time, water's passed under the bridge, and a lot of it in terms of being able to address that. So I will certainly share the honourable member's concerns with the College of Physicians and Surgeons, and I will indicate to them that I will share my comments that I've delivered in response to your comments here. So in terms of being able to do more than that, we'll have to monitor the situation very carefully.
The honourable member from Richmond.
Well, I appreciate what the minister is saying, and no one would ask the College of Physicians to cut any corners. But in this day and age, 2005, in the age of technology, in the age of communication, to suggest that checking someone's credentials would take 3 to 4 months is just ridiculous. Let's call it for what it is. It is ridiculous. A 4-month wait to check someone's credentials is ridiculous in 2005. Maybe back years ago when communication was difficult and sending a letter to the States took a couple of weeks, maybe. Not today. That's just unacceptable. And I would dare challenge anyone to come and tell me that a 4-month wait to check someone's credentials is legitimate in this day and age. And the College of Physicians have to start answering for this. And I can appreciate, I'd be frustrated if I was minister having to hear me express the frustrations at the government when the whole time you need to wait for them to make a decision. So it's time for the people of Richmond want to know who's responsible here and who's holding this up. And if that's the case, then let's deal with the issue right there. As far as I know right now, there is no doctor in sight. The question is, what do we do? How much longer do we wait? We're on 5 months now. How much longer can we go until we say something different needs to be done? And I appreciate the Deputy Minister indicating that there was some change in remuneration. There was. And I remember being part of that change in remuneration. But that was done. There was some increase in with the relocation money, and it was creative ways of trying to increase it without changing the classification. So the classification has never been changed. It's never been upgraded. And I would ask the minister if he would ask his staff to provide him with the salaries of the doctors in Ilmadam, St. Peter's, Lardwes, Port Hawkesbury, and Inverness, and compare those, the billable hours that they billed MSI compared to what was billed or what was paid to the doctor to Straight Richmond. You will see that there is a significant difference. So I can't accept the statement that remuneration has been tried and it didn't work. There were attempts to improve it. I agree with that, but it was nowhere near moving it to the new classification. And I'm not going to get into the A, B, C, D, and that. It's quite complicated. And hospitals fall under different categories, being the services they offer, whether they have an OR, whether it's just a simple ER, and how it is. The message is you've got to try something different at the Straight Richmond so that at least we can say, you know what, this minister has at least tried to address the remuneration. He's changed the classification. Hopefully now that this will bring the salary in line with doctors in the surrounding communities, and that may help. What we're asking is for at least some sort of movement on this, Mr. Minister, that would show you've taken this seriously. 4-month closure is unacceptable, and this is at least an attempt to make it more attractive for a doctor to locate to this area. That is something you can control, that is within your jurisdiction, and I would ask that you consider that. So I guess, is the minister prepared to undertake a review of the salaries, or however you want to put it, basically the take-home pay that doctors in the surrounding areas around this institution are bringing as compared to the doctor at the Straight Richmond, in the hopes that that will be enough to justify it's time to change the classification of that institution so that the remuneration provided to any new doctor would be comparable to surrounding communities.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and the request the honourable member made for me to review the salaries paid to doctors in the areas that he identified is something that we can look at and see what conclusions might be drawn from that analysis.
The Honourable Member from Richmond.
I'm just, you know, and I appreciate that the minister has indicated he would do it. I'm wondering, will the minister commit to sharing that information without giving names? Because I know that's very important. There is some concerns around privacy, and that's not an issue. But would it be possible that when that review is done, that the results of that would be shared with me for discussions with your staff based on the what outcomes come from that?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I will certainly be prepared to share whatever information the lawyers tell me I can share. Okay. Yeah.
The Honourable Lawyer, Minister, Member from Richmond.
Hopefully we don't get in a situation where lawyers are arguing with lawyers about what information you should be sharing. We'll do our best to avoid that, but I appreciate the minister's willing to look at that, and based on the information we've been provided, I think the results will clearly show that something needs to be done to change the remuneration at that facility, because no matter what doctor's going to come, the minute they start talking to the doctors around them and they see the amount of work they're doing compared to what others are doing and the difference in the remuneration, it certainly is an issue. And will it be the solution? Maybe not, but I can certainly tell you, Minister, I'd be more than prepared to go back to the people of Richmond and say, at least this minister has made a concrete change in the hopes of trying to address that problem. And I hope that's something that review can be done relatively quickly. One of the issues, unfortunately, I have to raise with the minister again this year, that he certainly would be familiar, him and his predecessors, that I've raised before, and I was interesting when we talked about the Richmond Villa and the amount of long-term care beds, and I'm sure the Minister of Education would be familiar with this, is the in-home support program. The program your government froze in 2000 to undertake a review. Well, it's been a 5-year review, and that's probably about one of the longest reviews that I've ever seen. The program used to give $400 a month to caregivers who stayed at home to care for loved ones who technically may have been entitled to be put in a long-term care facility, instead were kept at home. The idea being it was to provide some sort of financial compensation to families where a loved one may have not gone to work, may have incurred additional expenses because they were caring for a family member. It was a means and was an incentive. More importantly, it was not an expense. I would submit to you it was an investment. That $400 a month to a family, and I know there's still families in Richmond County are receiving it. I was pleased to help them back in 1998, 1999 in being able to get on the program. The problem is that when the government froze the program, they said no new applicants, but those who are receiving it can continue to receive it. And the frustration is that I have people call me and say, well, hold on now. My next door neighbor tells me you got them the in-home support program to care for their mom. I'm caring for mom and dad next door, and I can't get it. Why? And why should I continue to not go working, to have the expense of having loved ones at home, rather than put them in a long-term care facility, where we all know that the cost per day is well, I'm not even going to try to guess the numbers, but $400 a month compared to what it would cost you per month to put someone in a long-term care facility, it's just, the savings are incredible. So I asked the minister again, knowing the success that the in-home support program had, and the fact that this program fits clearly into its goal of allowing people to stay at home longer rather than going into long-term care facilities, why, in good conscience, has your government not yet brought forward either a new in-home support program or lifted the freeze on the old in-home support program?
The Honourable Minister of Health.
Receive funds.
Thank you very much, Mr. Chairman. I just want to make sure I get something clear.
The program has
Thank you, Mr. Chairman. I understand that just a little bit of the history of this program is one that came from community services to health, and then that wound up being frozen in that circumstance. I understand that community services themselves are articulating a new in-home support program for individuals of this nature, and I understand that there is funding available for them. I further understand that the clients who are being assisted in the program that we have now, that there is a complete analysis being done of their circumstance, and to see whether they would fit with the program Community Services is having or is implementing. And if they don't fit there, then clearly we need to find a vehicle that delivers services to them. So while the program there's not additional funds identified for it in this budget, there is activity relative to the program and what needs to be done to assist the clients in that program who are not going to be accommodated with other programs being provided by Community Services or ourselves.
The honourable member from Richmond.
And I know there's some confusion around this, because there used to be the old in-home support program that was frozen in 2000, and it used to be with Community Services, and I think the worst thing this government could have done is take it away from Community Services, because I think Community Services were the hands-on people who knew exactly what the situation was, and I can't speak well enough about the staff in St. Peter's in Richmond County and how well they administered the program, and they were there to help families. And no offense to the Department of Health, but that program should have never left Community Services. They were the ideal people to deal with this, and it should have stayed there. My understanding, and not to be argumentative with the minister, and maybe he can correct me, but my understanding is that the program Community Services is now offering is meant for children or young adults to stay at home. It's basically meant for families who have an income under $40,000 a year, I believe, that have a child with special needs, and that I think it goes from up to a certain age. So great program, and maybe we can look at that income cap moving down, but my understanding is that program is not available for seniors. And what I'm talking about is exactly what you were referring to earlier, trying to keep Nova Scotians at home longer so that they're not on the healthcare system, they are not in a long-term care bed. And that's exactly what this program was doing. And I can tell you the success. I know families, and I know that their dad should be in a long-term care facility. He'd qualify, I shouldn't say should be, he would qualify for that, there's no doubt, but he's being kept at home. He wakes up in the morning surrounded by family. He goes to bed at night surrounded by family. One of his daughters is staying at home with him. She cannot go to work as a result. She receives that $400 a month as compensation from the government for keeping her father at home where he wishes to be. The amount of money your government has saved just in that one example is incredible. And that's why I tell you that this program shouldn't be looked as an expense. It should be looked as an investment. Because if you keep that person home, and in some cases I know a family where both the mother and father are both elderly and would both qualify for long-term care, are being kept at home. $400 a month is what it's costing your government. Imagine, and you know the numbers, what it would cost per month for those two individuals to be in a long-term care facility. We've got to find ways to make savings in health care, and that program was the way to do it. And I saw the success when we were in office. I saw the success during the short period between when your government came in office and then the program got frozen, because we even got more people that were in at that time. But, I remember when your government came to power, one of the first things you said was, I remember the seniors' property tax rebate that had been frozen. And your government had indicated that you thought it was unconscionable to freeze a program where you had neighbors that were getting the property tax credit, seniors, and yet new seniors couldn't qualify for it. And you thought that was terrible. So be it. You made the change and you said, now it's available to all seniors. Yet here you have a program where, as I said, neighbor next door is getting it, and yet the next door, the other neighbor cannot get it and has been on a waiting list since 2000, when your government said it would undertake a review. I have to say that while I said that the College of Physicians taking 4 months to decide on a doctor's qualifications was ridiculous and wasn't acceptable, your government taking 5 years. 5 years these families have been waiting for your government to tell them whether they can get what their next door neighbor has been getting for years. Will the minister commit today to looking at reinstating the in-home support program, the program that is available for families who keep loved ones at home, for the most part seniors, that was providing them with $400, maybe more per month under the new program, whatever is available. But will your government commit, after 5 long years of finally taking concrete action on this matter, so that we can start allowing Nova Scotians to stay at home, which is what you've suggested, and we can start seeing real savings to our healthcare system, which I'm sure you'll agree badly needs it?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And we are in fact in the process of reevaluating not just this program, but the whole spectrum of needs of individuals such as those described by the honourable member, but not just seniors, the spectrum of age relative to keeping people in their homes for a longer period of time. And my deputy is working very closely with the Deputy Minister of Community Services to ensure that we're taking a joint approach to this problem, and that the policies that we will bring forward will in fact reflect the needs of clients of, or whether they be clients of community services or health, that the program we provide is indeed a program that provides the resources that will assist individuals, regardless of age, of remaining in their homes for a longer period of time. And that process is underway, and I anticipate bringing forward recommendations with respect to that consultative process and what is a policy development process that's currently underway.
The Honourable Member from Richmond.
Well, thank you, Mr. Chair, and I'm pleased to see there is some action going on, and I have great faith in your Deputy Minister, and I'm familiar with the Deputy Minister of Community Services, and I know that they are both relevantly, for the most part, new deputies in their current positions, which begs me a question: what were you doing for the past 4 years or past 5 years in regards to this program? And I'm pleased to see that you're having those discussions, and it just begs the question, and out of pure frustration, because as the Minister of Education can tell you, I have the letters from him, I have the letters from the current Chief of Staff for the government, Jane Purvis, when she was Minister, and it's just a history of it's under review, we think it's going to come soon. I think at one point I had the Minister of Education actually indicate that he expected there to be money in the budget. That was back in, when was he Minister of Health now? Back in what, 2002?
So long, I forget.
It was a long time ago, unfortunately, and I wish that he would have been correct in saying the money was coming. It didn't come. This is just one of those situations, Mr. Minister, where I don't know what else to do. I've tried hollering, I've tried writing, I've tried questions, resolutions, reason, please. I don't know what else it's going to take to convince your government that here is a means, and too often we're told that the opposition parties simply criticize and they simply want us to spend more. Well, this is an example where for the last 5 years I've been trying to get it clear to your government that this is a means of saving you money. This is a means of helping Nova Scotia families. This is a means of allowing our loved ones in Nova Scotia to remain at home for as long as they can, a means for your government to recognize that caregivers do need some support, and that home care is not a 24-hour-a-day service. When someone needs 24-hour service, home care can only provide so many hours. Somebody needs to be staying with them. That person should be recognized for the financial sacrifice they are making. They're not working, they're not contributing to Canada Pension, they're not contributing to any sort of other personal pension because they're caring for a loved one, which is wonderful. It's a great show of love and respect for their family member or their loved one. And at the end of the day, when we look at the economics, it saves the government money. It saves the Department of Health money. And if there's one department that needs to save money, it is your department. 11% increase last year, 9% increase this year. How much is it going to be next year? We've got to try to put in systems of support to keep people at home, and we can't just say it. We've got to have programs there to do it. And I know Community Services has started some steps to work with families that had, again, my understanding was younger children with special needs, or even young adults, for keeping them at home rather than having to put them in some sort of an institution or long-term care facility. And that's a wonderful program, and my only objection to it is that the income cap, I think, is a bit too high. But let me just finish my time by saying I hope in my time elected that I can see the day where the government will bring forward this type of program again. We are able to work with Nova Scotia families, keep loved ones at home, and see the success this program should achieve.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. I too am going to have some questions about long-term care, and I'd like to talk a little bit and get some information about the long-term care capacity in Dartmouth. And I want to start by telling you a little bit about Oakwood Terrace, which I'm sure you're all familiar with anyhow. But it is a top quality home for special care in my constituency, situated across the street from the Dartmouth General Hospital. And it's a nonprofit organization. It has 111 beds, and it has an excellent reputation to the point where it is pretty much the first choice of nursing home care for Dartmouthians. Currently, I believe there are about 29 residents who are suffering at various levels of dementia. And that nursing home has been trying to get agreement from the department to expand its capacity for several years. And I understand last year they actually put in a very detailed plan that that would create a third unit for their Alzheimer's patients. And this would allow the home to actually provide 3 separate units to accommodate people at different levels of functioning, and would certainly improve not only their capacity to take in more Dartmouthians, but it also would improve the quality of programming and life for the people who would be there and those residents. So I'm just wondering, what is the status of that proposal to expand from Oakwood Terrace?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The proposal that we've received from Oakwood Terrace is indeed a proposal that is under consideration. In the budget, we made reference to about an additional 125 to 150 beds in the metro area. We do know that a large number of those beds are going to go in the Bedford-Sackville area. However, the allocation or distribution of all of those beds has not been finally determined, and whether certainly the application from Oakwood is one that would be given very serious consideration as we take under advisement and make our decisions relative to the distribution of beds throughout the metro area.
The Honourable Member from Dartmouth, Dartmouth South, Portland Valley.
Thank you. Well, I'm pleased to hear there at least is some openness to the possibility of an extra 30 beds going to Oakwood Terrace. I'm curious, though, to know why the department would be seriously considering placing up to 150 beds in the Bedford area, when we've already heard from my esteemed colleague from Sackville-Cobequid that there's not 24-hour emergency service neither now at the Cobequid Centre nor at the new centre. Would not it make much more sense to place additional capacity close to one of the present hospitals?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. Really, the decision that we take with respect to the location of beds is very much related to trying to keep people as close to their home communities as possible in terms of their location of long-term care beds. Otherwise, from the metro area, we could just build one very big facility and be done with it. That's our objective, is to ensure that people can maintain as easily as possible the connect with their home communities. We have one of the finest ambulance services in North America, and that service is capable of responding to emergency services regardless of where they occur in the province.
The honourable member from Dartmouth South, Portland Valley.
Well, that really puzzles me, Mr. Chair, because I vaguely remember the controversy about getting nursing home capacity at the Mount St. Vincent, the Sisters of Charity Mother House. And here we had the opportunity to actually keep not only a number, I'm not sure, perhaps it was 50 or 60 sisters actually in their own home in a facility that had been renovated at considerable cost to the Sisters of Charity, but would also have the capacity to take in some other people. But instead, they didn't get a license, and those sisters had to be moved to a for-profit, I believe it was a Shanex facility, and the stress of actually moving some of those women resulted in their death. So I'm just wondering why that same principle wasn't being followed when the application from the Sisters of Charity was being considered.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And the honourable member's reference is not providing the complete story of the situation referenced with respect to Mount St. Vincent. It wasn't a matter of approving nursing home beds in the facility that was there. It was a question of whether we were going to okay the building of a new facility to accommodate the sisters, and that was not in the cards. And indeed, before a new facility were ever completed, the numbers of sisters involved would probably have changed quite considerably. So it wasn't a matter of approving the facility that existed at Mount St. Vincent. It was a question of whether we were going to approve new beds at that location.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. Well, sometimes I find my memory isn't as good as it used to be, but actually I had a work connection with the Mother House during those years, and I'm pretty sure that several millions of dollars were spent to bring that facility up to code, and that the unit that was prepared as a potential nursing home was fully equipped and operating for their own sisters, and certainly would have met the standards that the department required. But let me get back to Dartmouth. As you know, Oakwood Terrace is a nonprofit facility, so it has a community board of directors. It has well over 100 volunteers who complement the services of the staff. Any investment in that facility would go directly to salaries, programming, and services, all to benefit the residents who live there. Is it your intention, if you go ahead with your plans to put up to 150 beds in the Bedford area, will that be going to a for-profit or a non-profit organization?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. Just to go back to the Mount St. Vincent situation again, I think it's worthy to note the history of that particular facility. The application that was before the Department of Health was for a new nursing home facility. And indeed, the intention of the Sisters of Charity was to sell the convent, which they have subsequently done, and sold. So the application we had was an application for new nursing home beds. Now, the situation with respect to the Bedford area, these are replacement beds that were taken from Northwood. They were beds that had been approved for Northwood, and they wound up being, I forget the details of the circumstance around.
Standard changes.
Well, you know, there was changes in the standards of the building, and as a result of those changes, 100 beds were eliminated from the building itself, and a commitment was made to Northwood that they would be able to obtain replacement beds as a result of that decision. So if Northwood decide that they want to proceed with a facility in the Bedford-Sackville area, the replacement bed commitment will be applied to them in that circumstance. And if that goes forward, then of course it would be Northwood that would provide the service. In the event that that does not happen, then it would be appropriate for us to put out a request for proposal, and based on that request, a decision would be made with respect to provide the beds.
That decision's already taken.
Okay, all right. I'm informed that indeed Northwood have decided that this is what they want to do, and they're proceeding with the planning with respect to providing those 100 beds in that area.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. I'm wondering if, I realize you've set up a continuing care committee to assess capacity right around the province to help in some decision-making within the department. But I'm just wondering, do you have even any preliminary idea or indication of what the capacity needs are on the Dartmouth side of the harbour?
The Honourable Minister of Health.
Yes, there is a planning group that is providing to the consultative process the information that is referenced by the honourable member, and with that information obviously will formulate part of the recommendations that we will get from the consultation process.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. When do you think that committee will be reporting? And if it shows that there is great need in Dartmouth, would you consider reallocating some of those 150 beds to that side of the harbour?
The honourable Minister of Health.
Thank you very much, Mr. Chairman. What we do know with certainty is that the bed requirement for the metro area is in excess of 150 beds. So it would not be necessary for us to make a decision to move beds from the Bedford-Sackville area to some other location. We do know that the requirement for beds is sufficiently beyond that 150 number that other decisions beyond that will have to be taken. I anticipate receiving a preliminary report from the consultation process in the fall, with a final report coming in the spring.
Honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. So I assume then that the application from Oakwood Terrace then would be on hold until at least those preliminary reports came in. But am I hearing two possibilities? One, that some of the 150 seats allocated for Bedford could possibly come to Oakwood Terrace. I believe you said that earlier. And secondly, the government has the choice of increasing the number of beds in the metro area beyond the 150 that you propose in this year's budget.
The honourable Minister of Health.
Thank you, Mr. Chairman. I've just been given an indication here just to a high level to give some insight as to what's required in the future over the next 20 years. If we don't change how we provide services, and this is the reason that we're doing the consultation, the province would need an additional 3,600 long-term care beds over the next 20 years. Clearly, we need to get into providing alternate care with respect to individuals, because that is a huge requirement. So we do indeed need other ways of doing it. Perhaps the most and I do recall having said things that would cause the member to think that some of the 150 beds might wind up in Dartmouth. What the information tells us is that there is capacity for 125 to 150 long-term care beds in the Bedford-Sackville area. So it's in all likelihood a decision will be taken to move with those numbers. Now, when the consultation is completed, and indeed we receive an interim report, we may well garner enough information from that interim report to make decisions with respect to the allocation of beds elsewhere in the metro area as well as right around the province.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. It's interesting. I've been working with seniors in this province for probably the last 20 years. And I can't tell you how many consultations and meetings and forums and advisory committee meetings that I've attended over that period of time. And the outcome of all of them has been very similar to what the minister is suggesting now, knowing that we have to develop a continuum of housing options and care options for older residents, and especially that whole area of enriched housing. And I guess my only advice would be, we've got to stop studying it. We have to start moving on it, because people are getting older, and I'm sure you know only too well that the residents going into nursing homes and homes for special care currently are older and much more frail than they were 5 to 10 years ago. And often they are those members of our society who just can't stay home any longer. So I'd encourage the minister to take very quick action on this issue. It's a long-standing one, and it's not going to go away. It's just going to get worse, and the catch-up period is actually going to cause a crisis. I would like to move on to another line of questioning. There's a lot of concern and confusion over what's going to happen to both the programs and the facilities at the Nova Scotia Hospital. And I'm wondering if you can give me any information that I can share with my constituents to help them understand where in the decision-making process those programs and those buildings are now.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I appreciate the patience of the committee. The Choices program that is on that site is a program that will be relocated in the near future, and that's a firm decision. There are dollars in the capital budget this year to address the planning issues related to the other renovation projects that need to take place on that site. And that money will flow this year, and it will provide us with the direction and guidance that we need with respect to further decisions in terms of the investment of capital on those renovations.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. I'm wondering, are you planning any sort of communications program to stay in touch with people who both live and work in that area so that they can feel involved? They have a definite stake in what happens to those programs and that property. You may be aware that there are a number of small options homes and boarding houses and care and apartment programs in that area. They're very much related and focused on the day programs, the outpatient programs that are available at the Nova Scotia Hospital. And so any change to that program delivery is going to be have a dramatic effect or impact upon these people's lives. So I'm just wondering, what can your department do to reassure people and make them feel that they're both knowledgeable about what's going to happen and have some kind of control over their futures?
The Honourable Minister of Health.
Thank you, Mr. Chairman, and I thank the honourable member for that question. It indeed is a very relevant question with respect to the community that's there, because there is a considerable interdependence between the facilities on that site and facilities that exist within the community, and I'm aware of that from having my visits to the site and conversations with those who are involved in the provision of services there. So it is something that we will need to do an effective job on with respect to communicating intentions relative to that site. But because of the sort of community that's built up around the Nova Scotia Hospital site and the services that are provided there, that's one of the reasons that we want to look at doing as much renovation there as we possibly can, because there clearly is a support system that's out there that's interdependent upon the facilities and the services that are provided on that site. That particular site and those renovations are a priority of Capital Health as well as ourselves, and we will be working very closely with them, and I will certainly make the point made by the honourable member here is the need for us to communicate effectively, and I know the head of the communications department in my department is in the gallery, and she's making similar notes with respect to the need to do that.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. I appreciate hearing that, and I'm quite encouraged with the suggestion that there may be, even if those programs are regionalized or whatever, there may still be a role for that community in terms of delivering programs to people who are living there. Because as you know, there's the hospital across the road, Dartmouth General Hospital, the professional building. There are other supports in the community. I see the minister smiling. Have I read too much into his answer? But I certainly thought in the mention of renovations and whatnot that there seemed to be a continuing role for those, some part of that facility and that land.
The Honourable Minister of Health.
Certainly, Mr. Chairman, we do want to do as complete an assessment as we possibly can to ensure that, to use the honourable member's words, that some parts of the programs that are there would remain there. And but you know, as I indicated, we will be working very closely with Capital Health with respect to making those decisions, and there is an awareness of the service infrastructure that is developed around that site, and where appropriate, we would want to continue that relationship.
The honourable member from Dartmouth South, Portland Valley.
Thank you, Mr. Chair. I don't have a lot of time left, and I just want to mention that I frequently get calls and visits from constituents who are very concerned about the wait times. And I'm not going to go into all the different stories, but certainly the wait times for orthopedic operations, mental health services, and the emergency room, I would say, are at the top of the list, and you're very familiar with those issues. The other concern that seems to come into my office a lot is home care. And you know, especially the need for an expanded self-managed care problem, but also all kinds of concerns about the adequacy and the thoroughness of the home care program. I'm wondering, has the department ever considered the possibility of taking someone familiar with that program and sort of putting them at arm's length from the department as sort of an ombudsperson to help people who have concerns, legitimate concerns, help them sort of resolve those, help them navigate through the system, help connect them with the people that they need to get their particular situation in front of. It's becoming more and more of a role of the MLA's office, and I'm not sure that's appropriate. So I'm just wondering, have you ever considered setting up something like that? I know some of the major hospitals, I'm not sure what they're called, but sort of a patient advisor or whatever. So if you have a problem, you can call this person, and they usually can get it resolved fairly quickly. And it's someone who can take, you know, the lay person's concern, be able to transmit it to the professional and get the answer back in a way that that people understand. And it really accommodates people's different levels of need and understanding of the healthcare system. But I think of all the programs that this would be most relevant to the home care program, because a lot of stressed out family members and seniors are really struggling with knowing how to navigate that.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I want to thank the honourable member for bringing that situation forward. It is her suggestion is one that we will certainly take into consideration. I want to explain some of my own reactions and what I've initiated within the department relative to similar issues that you're referencing. I soon realized that we had a very serious weakness in the department with respect to our capacity to conduct an appeal of a decision. It became very apparent to me that the people who were considering the appeals were the people who made the decision in the first place, which is not a very appropriate method of gaining what we would. And I'm not casting any dispersions with respect to the professionals that are involved, but one who is receiving the decisions of an appeal would want to feel that that appeal process was conducted in a very objective manner. And so you have to ensure that, you know, that the impressions that are created is, you know, are the reality, and the impression should be that there is objectivity. So I have asked the department, and they're currently in the process of doing a complete analysis of our appeals procedures. And I'm going to ask, and they understand this, that we put in place a more objective method of considering appeals to decisions that are taken, so that the first steps would obviously to appeal to the, you know, have a reconsideration of evidence that is brought into a decision. And if there is not satisfaction with that decision, then we need to have another level to go to with respect to considering it. Now, I don't know if that fits completely with what the honourable member is suggesting, but whether we have one individual or a single office that sort of does this, I'm going to await the recommendations of the department with respect to how we do this. I do know that there was absolutely no resistance on the part of the department of getting on with this project, because they understood, as did I, that we had to have a better system. I will certainly pass on the suggestions as you articulated them this evening, and have those suggestions considered by the department as they formulate their recommendations to me.
The Honourable Member from Dartmouth South Portland Valley.
Thank you, Mr. Chair. I want to thank the Minister. That's exactly the kind of thing that my office has been dealing with, and I neglected to mention appeals, but that has been a big part of it. And as you're familiar, I spent a year trying to help one particular patient with MS receiving home care sort of navigate and go through the appeal process. And, you know, by the end of it, I fully understood her level of frustration. And I could understand the frustration of the people we were dealing with, the officials in the department as well. I'm sure this is very time-consuming, and I suspect they would be very pleased to have it sort of segregated off into, you know, a sort of arm's length group of people looking at that. So I'm very pleased to hear that you're pursuing that, and I certainly encourage you to set up something like that unit. Thank you very much.
The Honourable Member from Hants East.
Thank you, Mr. Chair, and I want to thank the Minister and his staff for some time. And I know I'm not sure that you know, there's not a whole lot of snap, crackle, pop, you know, in the estimates, and so I can see how you know, 4 hours would may seem like an eternity. Not that I'm going to try to be any more entertaining than anybody else. I want to first of all, I want to thank your Deputy Minister and staff. Have had the occasion, two occasions recently, one on the long-term care issue, and where the deputy met with people from my constituency, and actually, you know, I would say was very gracious. Even if the response had been more negative, they were well received, and that issue actually, the last information I had is that I think they've got something that works, and I want to say thanks on behalf of those people. It's a very important issue in my area, and I know that they really appreciate it, and I appreciate it, and I appreciate the way your staff handled that. The other area I want to address, and this was also an issue where I was in with the Rawdon Hills Health Clinic people, and we met with Mr. Miller and Ms. Payne in your department, and actually had a very good meeting with them. And the basis of their request, Rawdon Hills Health Clinic basically has been formed since I've been elected, since '98. And I remember being at the very early ground level of this community, trying to get something going there. And when I think back to how green I was on so many of these issues, and my learning curve going straight up, but I'm amazed at what this community has done. As a matter of fact, I'm amazed at what communities do, you know, by and large by volunteers. And so they're operating out of the basement of the church, or basement of the manse in Upper Rawdon, and you know, that's just not going to work. They do have a piece of land for a site. They have the well. They have the disposal field in. They've got $55,000 or some such thing in the bank. They did get part of that with money, I think, from the municipality. They have one family has done sleigh rides, you know, donating the money to the health clinic. Somebody else will make a quilt. They have auctions. You name it. I mean, if there's a way to generate funds for this project, they've been doing it. But I got to say, Mr. Minister, that not only are they trying to do that, but they're also trying to run the clinic, you know, that they have. So the basis of our meeting was to see whether or not there was any possibility of funding from the department. And so with this meeting we had, it became clear that there was indeed a very real possibility of some help through federal transition funding. And Mr. Miller and Ms. Payne, they were very helpful, I have to say. And they suggested that this group make a presentation to the DHA, and they wanted to feel secure in the thought, I guess, that the DHA supported the Rawdon Hills Clinic in this endeavor to build this facility. So that's what we did. We went and met with the staff at the DHA. That was Mr. McKinnon and Dr. Sean McCormick and Tracy Martin, who was involved with the primary care side and actually working under Eleanor McDougall. And the chair, Karen Casey, was on that meeting. That was a much more difficult meeting, I want to say. And I'm not sure that the minister could ever believe from my demeanor that I could leave in a frustrated manner. But I want to tell you, it wasn't just a trip home from Truro to Enfield that I needed to cool me off, because even weeks later, it still goes through my head. But the impression I got from that meeting was that they didn't really support the Rawdon Hills Clinic, number one. That was the first message that I got. And I think if the message finally boiled down that they wanted to be sure that the other members of the Hants North Area Health Cooperative, and the Minister of Education would remember that because we took a delegation into him. And I think at that time he and your present deputy, who was, I think, the assistant deputy perhaps at that time, I think they were very helpful at that time to come up with this notion of this Hants North Area Health Cooperative, which was a kind of an umbrella for Knoll, Kennecook, and Upper Rawdon. And I was impressed, I have to say, because they tried. And anyway, the East Hants Community Health Board had put together their health plan. As a matter of fact, they had a health plan very early in this whole process. Matter of fact, their health plan was together pretty much before the government changed, when it was the health districts. And so they were up and ready to roll. They submitted their plan to the DHA. The DHA approved their plan, and the Rawdon Hills Health Clinic is part of that plan. So when we went to this meeting with the DHA and got this message, I did, that indicated to me that they weren't all that supportive of this notion, and I was quite taken back, and told them, you've already approved it. You've already approved 3 clinics for this area, or a plan for three clinics. And I also tried to make the case that the dollars that we were coming after were not really their dollars. They were federal dollars. And I think when I left the meeting, because I had to leave a little early of it ending, was that they wanted some assurance from the other clinics, Kennecook and Knoll, that they were in agreement with what direction the Hants North Area Clinic was going. And I have to tell you, Mr. Minister, and I'm not sure that, I'm not going to assume that you micromanage the DHAs, but about a week after that, there was an announcement in the paper that the DHA was spending $2 million in Tatmagoush to renovate the Lillian Fraser. Now that was their money. And we have a new resource center just about completed in Elmsdale that the DHA wouldn't build. Matter of fact, when we tried to get them to build something in East Hants, they said we don't build bricks and mortar. So, but yet, that's exactly what they're doing for the Lily and Fraser, is they're spending money on bricks and mortar and they're renovating that facility. So the taxpayers of East Hants have picked up the tab for the resource center, which is, you know, $4.5 to $4.7 million. So I'd like, I guess, to hear your comments. I'd like to know if you can tell me if is there a way to know how much of the DHA's budget goes from the people of Hants East? I'm assuming it's not a per capita basis, but if it is, I'd like to know that. But is there a way to know how much money goes from the people of Hants East toward the DHA that covers their area? And you can comment on my other comments because they weren't questions. So.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. With respect to the last question that the honourable member raised, well, off the top of my head, I'm not sure what vehicle we would use to try and put that information together, because it's not something that we normally think in terms of with respect to expenditures. I am certainly familiar with the facility that the municipality is building. I had the opportunity of touring that facility with the warden and the past warden, and with the members of the DHA and the project manager, and that facility is far greater than just a healthcare facility. It's quite a credit to the community, really, to be able to go ahead with a facility of that nature. And I think it's one of the steps in terms of recognizing that what is coming together in that area is if you like, a sort of new focal point, and this is a major piece of the infrastructure of that, that new focal point. You certainly have in that area the commerce centers that are required to support and sustain a community. The facility that the municipality is building is a facility that provides sort of the service element related to what a community needs to sustain itself and survive. And we sometimes think of these as being services that are traditionally provided within towns, but this is one that is, that's being provided by the municipality, recognizing what the citizens in that area need, and I consider it to be a major step forward for that municipality and for the community in particular. And I'm pleased that the District Health Authority is part of that. I think if you look at it, at that situation in hindsight, you may be the beneficiary of what you consider to be a bad decision by the DHA, that they did take the decision they did because it provided an opportunity for a much broader facility to serve the interests of the community, and I'm pleased that the healthcare services are an integral part of that. Not sure you share my view in that regard, but I think in hindsight, the community is going to be well served by what's happening there. With respect to the other project, obviously I'm not up to date in the details relative to that. I do. I guess the question I want to satisfy myself about relative to all of that is the degree of cooperation that does exist in all of those centers that you reference, and I want to find out about that, because I'm certainly very curious to know what the relationships are there, and I will do my utmost to get some information on that and see where it takes us.
A member from Hants East with approximately 7 minutes left.
Thank you, and I don't really have that much, Mr. Chair, but I want to say to the minister, you know, I was raised on a farm, so I know about looking a gift horse in the mouth. The resource center, and the comparison I'll make to other places that were funded by the DHA solely, there was health services went into those places as well, paid for by the department, yet the department built the structure or whatever. And that didn't happen here, and that's the point that I want to make. And we appreciate those services. Actually, they were in Hanseast, a number of them. We just collected them into that one facility. So, you know, I think if the province wanted to put $2 million, you know, back to the municipality, you know, on that they would probably consider that great. And we do appreciate the help from the department and the DHA. I want to say I tabled a petition here on requests for dialysis in that facility, and I'd like the department, you know, to think about that. People would also like to have X-ray services there as well, and it is a focal point. It is a good initiative, and I don't want to see the people of Hanseast, you know, seem to be doing things with their tax dollars, municipal tax dollars, that other people are getting done through their other tax dollars and seem to be paying twice. And so with that, I'm going to have to take my place because my colleague is expecting some time, and I got to be fair. But with my final comments, I would like you to give whatever consideration to the Rawdon Hills Health Clinic and their initiative, and I want to say thanks again to your staff for their help. I really appreciate it, and I know the people there do. Thank you.
The honourable member from Pictou West with about 3 minutes left.
Okay,
5 minutes left.
Thank you, Mr. Chairman. And I know my time's going to be interrupted by the late debate, so I'm going to ask you some short snappers, Mr. Minister, before the adjournment, and then we'll have some other issues for you afterwards. I want to come around, first of all, to the initiatives in the budget around diabetic low-income coverage, and I certainly welcome that initiative. I know it was, we had hoped that it would actually be here last year. It was in your throne speech, and there it wasn't, but I'm very glad to see it this year. Can you give us some details on just how the program is going to work, who's going to be covered? Will like strips and needles and insulin, will all supplies be covered? When will it start, and where's the income level for coverage?
Thank you very much, Mr. Chairman. First of all, I want to comment about the commitment that was referenced in the blueprint and the amount of money that we've identified this year. The money that was identified in the blueprint was for a much narrower program than the program that we're going to offer. The program we're going to offer will include, I don't have the list in front of me, but it certainly includes sticks, it includes insulin, it includes syringes, the needles, it includes what are the other? Oral medications that would be required. So all of those medications or test devices that individuals would need in order to be able to control their disease effectively will be provided by this program. So the program that was committed to in the blueprint was a much narrower program that focused on test strips only. So that, now, the reason that the number is lower than the $3 million identified in the blueprint is because we're really beginning what's going to be an $8 to $9 million program. And the take-up on programs of this nature are, and we were quite surprised to learn this, in other jurisdictions is much slower than one would anticipate. But this is certainly sufficient money for us to begin the program this year. The income levels have not yet been determined. They will be, and we're working within the Department of Health and with with the Canadian Diabetes Association with respect to coming to those income levels. And the program, we hope, will be operational in the fall, maybe late fall, but by that time frame. I do, by the way, I've asked the department to provide a complete briefing note that I will make available to all members of the House with respect to the details around this.
The honourable member from Pictou West.
Thank you, Mr. Chairman. No, I certainly welcome the initiative. There's a lot of diabetics throughout the province, and certainly in my riding of Pictou West, I've had a number of contacts from people that are looking for answers and are very much looking forward to the help that will be provided. I assume that it's available to all low-income Nova Scotians that qualify. It's not just people on the community or on social services, but all people with an income below a certain threshold. Do we have any idea where that threshold might be? Is it 15,000 or 20,000 or just what?
The Honourable Minister of Health with 1 minute to go.
Thank you, Mr. Chairman. Currently, all of the services that I referenced are provided to community services clients. Okay, so we're talking about low-income Nova Scotians over and above that income threshold.
Not insured.
Okay, not insured, people who do not have insurance. Right, so that's the group that we're talking about. All Nova Scotians.